Our today's topic is otosclerosis. It is one of the most important topic of ENT and it is often asked in exams. We will discuss in details the otosclerosis, how it is caused, the causes, definition, the key concept, which was involved, etc., and the clinical features and all the things which you need to know. There are a lot of things to be discussed. These are the learning objectives of the Otosclerosis part 1 of this video. We will discuss all these things in this video. Before moving into the theoretical part like the definition, causes and all the things, I would like to give you the key concept exactly what is otosclerosis. As we know that air has a external, middle and internal air. We all know the anatomy of air. So basically in otosclerosis, we know that the inner air is surrounded by a bony capsule which we call otic capsule. Okay, so inner air is surrounded by the otic capsule. Basically in otosclerosis, the otic capsules, which is a bone, uh, the endochondral part of the bone is replaced by the irregular spongy bone. Normally we know that the otic capsule has endochondral bone, but in otosclerosis it is replaced by the irregular spongy bone and it becomes an abnormal bone. So it causes the inner air. So there is a problem in inner ear bone. But we know that in anatomy we know that the middle ear has three bones: malleus, incus, and stapes. Stapes has a foot plate which is attached to the oval window of the inner ear. Okay, you can see it in the diagram which is zoomed here. See in the circle, the yellow one is the stapes and its foot plate is attached to the white one which is now autosclerosed. The white one is the oval window. So if the oval window is affected by autosclerosis, so if there is a problem in the oval window, the stapes foot plate got attached and it caused the fixation of the stapes. It means the stapes can't move and can't transmit the sound waves from external ear to the inner ear. We all know that the bones of the middle ear has the function of to transfer the sound waves or vibrations from external ear into the internal ear. So in case of otosclerosis, this function can't occur, and which type of hearing loss would be occur? It would be a conductive type of hearing loss in otosclerosis. I hope it clears the key concept of otosclerosis. If you have any question, you can ask in the comment section of this concept. Now come to the theoretical part. What is otosclerosis? As I already told you all that it is the primary disease of bony labyrinth or otic capsule. Otic capsule is the bony labyrinth that surrounded the inner ear. In this condition, normal endochondral layer of bony capsule is replaced by spongy bone. Key feature is what is key feature? The otosclerotic focus involves the stapes region. I told you previously that it involves the stapes, leading to stapes fixation and conductive hearing loss. The concept I discussed earlier. Okay, location. What is the location of otosclerosis? You can see in the diagram. So, what exactly is otic capsule? It is shown in the here in the diagram. This is the cochlea, yellow one, and this blue one is the semicircular canals. So the cochlea is usually surrounded by the bony labyrinth and the upper semicircular canal. The inner part is the membranous labyrinth. Okay, so these are the location, the two locations, the industrial layer, it is the innermost layer of bony labyrinth, and otic labyrinth, which containing membranous labyrinth containing the otic labyrinth. So what are the causes of otosclerosis? The first is genetics, familial tendency. Second is gender. Females are more affected. Females are more affected, probably due to the estrogen that causes inflammatory reaction in the bone. And age is typically between 20 to 30 years. Autoimmune factors can also play a role in otosclerosis. Otosclerosis is basically related to the Van der Hoef syndrome. So what is Van der Hoef syndrome? Van der Hoef syndrome, it is associated with three diseases. It is a triad of disease. Number one is osteogenesis imperfecta. In osteogenesis imperfecta, the healthy bone is converted into the brittle bone, a weak bone, due to osteoclasts and all the cells. So, van der Hoef syndrome include otosclerosis, osteogenesis imperfecta, and blue sclera, which is the bluish discoloration of the sclera of the eyes. You can see at the bottom of the slide the blue sclera. There are also three types of otosclerosis. Number one is stapedial otosclerosis. It involves the stapes bone and leads to conductive hearing loss, which I gave you the concept in the start of the video. The second one is cochlear otosclerosis. It affects the cochlea, which I show you in the diagram in the first, I think so, second slide, your third slide, which the blue one or the yellow one was the cochlea. It affects cochlea, then it results in sensory neural hearing loss. If it affects cochlea, it is sensory neural hearing loss because the cochlea supply the vestibulocochlear nerve, which is the auditory nerve. Okay, so it causes the sensory neural hearing loss. Number third is histological otosclerosis. Means presence of autosclerotic bone changes in the ear tissues. Not a specific ear part is involved, but it is histologically present in the ear. And no noticeable hearing loss is present in histological type of otosclerosis. What is the clinical features? Number one is hearing loss because it commonly involves stapes, so the type of hearing loss would be conductive hearing loss most of the time. But if it involves the cochlea, it is sensory neural hearing loss. Paracelsus felici, it is a characteristic symptoms where the individual hears better in noisy environment. Means the patient hears good in noisy environment as compared to the quiet ones. Why it is happen? It happens because in the noisy environment all the people are shouting or speak loudly, so they can hear the voices in their ear. It is called Lombard effect. It affects demographics. It affects 20 to 40 years old, basically females, young females. If you have any question, there are more. There is more detail to atherosclerosis. I will discuss in another video in atherosclerosis part two. If you have any query, comment down, comment below, and please don't forget to click the bell icon and subscribe the channel if you like the video. Thank you.